Thank you, Mr. Chairman. I appreciate you calling this important hearing. As we face the very serious challenges before us, I first want to start today with some positive news. After a long and difficult few months, the American recovery is finally underway. All 50 states have finally begun reopening. Last week, we just got the May jobs report. And instead of what was expected to be a 7.5 million additional jobs lost, instead, we shattered the post World War II record by creating 2.5 million new jobs in May. That's a swing of 10 million jobs to the positive. The Paycheck Protection Program that we passed together, Republicans and Democrats working with President Trump, has made loans now to more than 4.5 million small businesses. And that's over $500 billion in loans to save millions of American jobs for those hardworking families that enjoy them today. Clearly, the work we have done together has helped Americans make it through some of the toughest times in our nation's history. And now we're seeing the American people burst out of their homes with energy and determination to get back to work and to make America a more perfect union. Today's weekly unemployment claims remind us that we still have work to do. Our job now is to keep this recovery moving forward. While we know the virus is still out there, we also know that we've turned a corner in our response. We've conducted more than 3.2 million tests just in the past 7 days. Production and delivery of PPE increases daily. The private sector, FEMA, and HHS have delivered tens of millions of N95 respirators, surgical masks, face shields, and over 1 billion surgical gloves have been delivered. Under President Trump's leadership and direction, the FDA has expedited promising therapies and vaccines that are being tested as we speak. Make no mistake, COVID-19 is an insidious and evil enemy. As today's hearing underscores, this hidden enemy attacks the elderly at an alarming rate. Our job is to protect those most vulnerable. Nursing home residents make up only 0.6% of the American population, yet they have accounted for over 40% of the national COVID-19 deaths. This is unacceptable, Mr. Chairman, and more sadly, this was largely avoidable. The decision of several governors to essentially mandate that COVID positive patients go back to their nursing homes, even if those nursing homes were incapable of properly treating them, ended up being a death sentence. New York has suffered 6,299 deaths in nursing homes. For New Jersey, it's more than that, 6,309 deaths. Compare that to Florida, which is a retirement state, which had less than 1,500 deaths. All tragedies, but wide disparities. On a per capita basis, nursing home deaths in New York are 500% higher than in Florida. In New Jersey, it's even worse, over 1,120% higher than in Florida because of those decisions. Other states like Michigan, California, and Pennsylvania that forced COVID positive patients back into nursing homes have had similar tragic disparities. Today, Mr. Chairman, we should be focused on what went wrong to stop that from happening again. Let's walk through what happened. On February 6th, CMS released this first guidance for COVID positive nursing home patients. The administration had seen that we were beginning to have this unfolding in Europe, and they took quick action. On February 29th, America experienced the first nursing home outbreak in Washington state. On March 13th, CMS updated its guidance to continue clarifying how to treat COVID positive patients that were discharged from hospitals. CMS Administrator Seema Verma said, quote, under no circumstances should a hospital discharge a patient to a nursing home that is not prepared to take care of those patients' needs. That was a clear directive. But unfortunately, on March 24th, Governor Cuomo's health department issued this directive in contradiction to the CMS guidance by mandating that nursing homes take COVID-19 positive patients. New Jersey essentially copied verbatim the same directive from New York's order with similar deadly results. 2 weeks earlier, Governor DeSantis in Florida prohibited transferring COVID-19 patients who were positive from hospitals to nursing homes. Very different orders yielding very different results. On March 18th, Pennsylvania also issued guidance mandating that nursing home patients continue to accept new admissions and readmissions, including patients that were COVID-19 positive. While defending this decision, Even Pennsylvania's health secretary moved her mother out of a nursing home. On April 15th, the governor of Michigan issued a similar executive order mandating that nursing home patients have to be accepted regardless of COVID-19 status, even if they couldn't properly take care of them. Again, in contradiction to the CMS directive. Michigan State Representative, who's a Democrat, Leslie Love, actually criticized that decision publicly, calling this reckless order, quote, an epic fail. Mr. Chairman, shockingly, this order in Michigan still remains in effect today. I'm calling on Governor Whitmer to rescind this order immediately. And I hope all of my colleagues join me in calling on this to be rescinded because it is having deadly, devastating consequences for seniors who are COVID positive in nursing homes. I've drafted letters for each of these governors requesting information on what led to these tragic decisions. I would ask all members of this subcommittee to sign on to this letter so we can get that information and prevent more unnecessary deaths from occurring. Let's work on a bipartisan basis to get all of this information out there to ensure that these deadly mistakes are not repeated. Again, Mr. Chairman, look, the American people are deciding to get back out there, to reopen the economy, to get back to work so that they can rebuild and get their jobs back. It's time for us to stand together for justice and equality. To do this requires that we protect those most vulnerable to this virus. We must turn a bright light of sunshine on the mistakes that were made so no more needless deaths occur. With that, Mr. Chairman, I yield back.